Let's talk about BNP versus troponin. So BNP is a hormone that is released when the ventricles of the heart are overstretching. So what's going to cause that overstretching? Too much fluid. So the heart is basically sending out a signal saying, hey, there's too much fluid in here. We're stretching a little too much. Now BNP is something that we use to help detect heart failure. So if the BNP is less than 100, that's normal. If it's higher, then that could indicate heart failure, and the higher the BNP, the more severe that the heart failure could be. Refer back to my video over compensated heart failure. What's happening? The RAS system is kicking in, and now the body's holding on to fluid. But the thing is, BNP and the RAS system are gonna just start going to war with each other, because now the body is starting to fill up with too much fluid, and those ventricles are going to start filling up too much, stretching too much. That's going to cause BNP to be released, and BNP is going to say, hey body, get rid of this sodium, get rid of this water, because these ventricles are filling up too much. Now let's talk about troponin. Troponin is a protein that is released whenever cardiac muscle cells are damaged. And this is basically the golden standard for detecting a myocardial infarction. Now a normal range for troponin is anything less than 0.04. Anything higher than that could indicate cardiac damage, but the higher the number, the worse it is. What's happening is you have the heart attack, which is the blockage of the blood vessel. So now there's no oxygen getting to those tissues. Those cardiac tissue cells are dying. Then when they rupture, they release troponin into the bloodstream. Now, the peak time for troponin is 12 to 24 hours after the heart attack, but you can start seeing a rise 2 to 4 hours after the event, and these levels can stay in your system for several days. With all that being said, you can have a patient who comes in with sudden chest pain and you draw their troponin levels, but nothing's elevated, and that could be because it just happened and the troponin just needs time to go through the bloodstream and become elevated. So you're going to want to do repeat troponin lab draws probably every 3 to 6 hours, at least in the beginning, as well as once you've confirmed the myocardial infarction and the patient is being treated for it, even though they're not having any pain, they could still show elevated troponin levels just because those do stay in your system for several days, sometimes like 7 to 10 days.